I think there's a lot of it is unknown, right? And it actually is very rare that it's because you weren't the right fit. It's rare. And that's okay, because usually you will know in the assessment that you were not the right fit. Okay. Meaning, like, I saw a patient the other day too. I was like, look, you're not ready for ortho treatment. Like, we need you to work with our pelvic health physio for at least the next 4 weeks. So I wasn't not the right fit because of my personality. It's just that I actually thought somebody within our organization had the skill set that I didn't have to get them on the right track first. Okay. Doesn't happen to me. That's bullshit. It happens to all of us. This one I always don't like is when I don't know. It's like, well, if you don't know, then we need to find out. I don't know what's wrong with your shoulder right now, but my job is to figure that out, right? Same thing with this stuff. Operations is no different than clinical case studies, okay? I don't like to wait and see if he or she rebooks. Potentially, it may be something that you may, want to wait a period of time before you actually can engage in the conversation. I mean, like, I'm not going to call in, this quick 15 minutes between patients. Maybe I will wait to tomorrow when I know I have a gap in my schedule, where when I get them on the phone, I can actually give them, the necessary amount of time. Okay. This is definitely the part that is really flip-flops between organizations, right? I think the important part is to know if we can capture or collect any information of why they've chosen to cancel all their appointments. Okay. Sometimes, though, it's just about how we ask. It's just making sure too is, oh, sorry to hear, that you have to cancel all your appointments. Is there anything that we, would you mind if we actually ask if there's a reason why, or is there anything we could do to support you in the interim, right? Just checking to see if everything's okay. You know what I mean? Like, just looking at how do you engage in that conversation. They may not actually, usually when they cancel them all, they probably won't want to speak to anybody. So they may leave a voicemail, and they'll usually call after hours. Okay. So the admin could call to inquire. It's really just about checking in. Okay. If the clinician, so I actually believe that this is more of a clinician role. Somebody comes in, they cancel all their appointments. Oftentimes what we have seen is really, again, nothing to do with the clinician. Usually a family emergency comes up and they just cancel them all. Usually all of a sudden they got sent, something comes up for work and they actually have to go, and they're away for 2 weeks. Their partner decides to book a family vacation for the next 2 weeks, and they only book 2 visits, so they cancel everything. And they're going to call us when we get back. Okay. But very rarely, like I said, it's a fit issue. Sometimes too, someone may cancel because they find out they don't have any insurance coverage. It happens. It's rare, but it's possible. But it would be good to know, because maybe I can actually support that individual by at least providing them a home program that they can work on. Or maybe I can actually utilize an assistant in the clinic, and maybe there's a compassionate rate program that I could offer them. It's just an option. They can still say no. But it's really about just checking to make sure that everything is okay. Okay. And remember, some of these people, unfortunately, just get dealt with really bad news about stuff. Maybe their blood work came back and they have a terminal illness. All of a sudden, their back pain doesn't hurt anymore because they've got bigger issues to deal with. So I think when we always look at this information as, I need you to call Chris because you must have screwed up. No one wants to make those phone calls. We really just want to know, is there an opportunity to support that patient? Because maybe it's not the right time, not the right fit. Okay. But again, this is definitely something that doesn't happen that often. But looking at book to prescribe ratios and understanding, behaviors of patients afterwards is important for us to be aware.